Hi everyone, my name is Nicole Benavides and today's topic is Ivabradine in Cathecolamine induced tachycardia in a patient with Paraganglioma. Definition: Paraganglioma-related clinical sequelae results from catecholamine secretion can cause hypertension, tachyarrhythmia, multi-organ failure, and death. Here is a video.
Health Matters is the informational webcast brought to you by NetMeds, designed to keep you informed and up to date on popular medicines, emerging therapies, and even cutting-edge strategies for enhanced wellness, less sickness, and greater energy. This medicine contains Ivabradine, which belongs to the class of anti-anginal drugs. It works by reducing the heart rate by a few beats per minute and helps you improve the functioning of the heart. Talk to your doctor before taking this medicine. If you are allergic to Ivabradine, if you have heart, liver, or renal problems, if you have low blood pressure or chronic eye retinal disease. This medicine should not be taken by pregnant women and breastfeeding mothers. Consult your doctor for advice before taking this medicine. Talk to your doctor if you are taking medicines such as medicines for treating fungal infections or any infections, medicines for treating fits, heart problems, or any psychotic condition, medicines for insomnia, depression, anxiety. Refer to the table for detailed information on drug interactions. Stop taking this medicine and see your doctor immediately if you experience the following side effects such as luminous visual phenomena, irregular rapid contraction of the heart, abnormal perception of heartbeat, uncontrolled blood pressure, headache, dizziness, and blurred vision. For further details, refer consumer medicine information at netmeds.com. netmeds.com, इंडिया का ख्याल रखें, इंडिया की फार्मेसी.
So, let's continue. Application in medicine. Catecholamine increase heart rate via beta-arenator stimulation and beta and calcium channel blockers. Modulates these effects by inhibiting the signal cascade. Although beta-adrenergic receptors desensitization occurs with prolonged catecholamine stimulation. Tachycardia persists despite some maximal beta-adrenergic receptor blockage. Here's another video.
Now, multiple MR images here demonstrate a large mass in the left upper quadrant. Now, notice that this mass isn't arising from the adrenal gland. It's probably just arising from the retroperitoneum. You can see that it's T1 hypointense, T2 bright, and demonstrates avid enhancement. Now, if it was coming from the adrenal gland, I would say that it was probably a pheochromocytoma, but this isn't coming from the adrenal. This is an extra-adrenal pheo or a paraganglioma.
I used to always think about like whether really the life is on, they'll be able to save my life.
This young gentleman who came to us with severe backache and pain radiating down his legs had a tumor that was potentially curable in his spine, and we were surprised to find the way it presented was very unusual, with a long-standing history of hypertension, and his backache actually followed much later. Now, when you are presented with an unusual diagnosis, which is difficult in such instances, it takes a multidisciplinary team.
On MRI, which showed there is a large tumor involving the lumbar vertebral body L2, and it was spreading to the abdomen. We call it retroperitoneal structure, as well as causing compression of the dural tubes, nerve structures. And subsequently he underwent a biopsy which revealed there is a paraganglioma. Paragangliomas are very rare tumors in the vertebral bodies, and not only that, they are very highly vascular. Highly vascular in term means they bleed a lot during the surgery.
These paragangliomas can be of two types: either they secrete hormones which can cause hormone problems, or they may not secrete. In his case, he had blood pressure and he had few symptoms on discussion which I felt that we need to make sure it is either producing the hormones or not. So we sent him away to do some special investigations on his blood and urine, and that revealed that indeed these paragangliomas are secretory, by which I mean they were producing hormones in excess. This becomes an added problem with regard to surgery, because if we do not use specific medications to control blood pressure and his heart rate, during surgery when they open up this tumor and they remove it, these hormones can suddenly get into the blood circulation, and a sudden surge in these hormones can cause problems with blood pressure and heart rate, and it can be of severe consequence to the patient. Therefore, achieving a very good blood pressure control, heart rate control was important. So, Jagdish went on a particular group of medications so that we could achieve a good control of his blood pressure, apart from ensuring he is well hydrated. We did this after he got admitted, ensured that he was in the right state physiologically to go ahead with the surgery.
We did the surgery in two stages. First one, from the front, the oncosurgeons along with oncosurgeons, they removed the retroperitoneal compartment of the tumor, and before proceeding for the surgery, as I said, this tumor is highly vascular. We had to embolize this tumor. Embolize means cut off the blood supply. So our interventional radiologist, he did a embolization of this tumor, where 90% of the tumor was blood supply was cut off, but still there was 10% of the tumor which the tumor would bleed. So oncosurgeons first from the front, they went and removed the part of the tumor which has spread to the abdomen, and from the same sitting we removed completely the tumor from the front. It was involving the L2 vertebral body, and after that, removing the body, there is an empty space. We have to put a metal cage. So metal cage was put with the bone graft material, and during the surgery his blood loss was controlled with anesthetists, managed the blood pressure.
For anesthesiologist, it is a huge challenge to manage such patients. We, with our facilities, state-of-the-art facilities in our hospital, we could manage this patient successfully.
So let's continue. Pros and cons. Pros. Ivabradine is the only commercially available EF current inhibitor, acting directly in the sinus node without adverse cardiovascular events. The regulation of intrinsic pacemaker in the SA node is paramount in heart rate control. Other treatment options have more side effects. In cons, it is important to note that ivabradine acts alone in the SA node. Therefore, catecholamine effects on the AV node and cardiomyocytes will not be mitigated by this drug. Here is another video.
These new guidelines, can you tell me a little bit about them?
Yes, well, there are several reasons why we felt the guideline might be usable for endocrinologists, physicians in general. And that the first one is that pheochromostroma paraganglioma is very rare, a very rare disease with a variable clinical presentation, and I would say a doctor has, well, it will be very difficult for a physician to get experience with it because it's so rare. And I think even in larger medical centers, the frequency that the doctors see this tumor is also very rare. So the experience is, for a single physician, limited. That's one reason. The second reason is that if you miss the tumor, if it's not diagnosed and treated properly, it's associated with a considerable risk of cardiovascular morbidity and mortality. And that leads to doctors perform many tests to rule out the tumor. and so I think that's the second reason why a guideline might help to, let's say, to establish the most effective test to rule out or confirm the tumor.
Really, the ability to spare patients having to undergo unnecessary tests.
Well, that's one of the reasons why we felt it might be good to have such a guideline. I agree.
But also in helping to educate the clinicians who, as you mentioned, might not have the opportunity to see
Yes,
this.
I would say the most important step to improve the outcome and the prognosis of patients and also the relatives, that's early recognition of signs and symptoms, so early considering the tumor. And because you can have the best test on the world, but if you do not consider the tumor, then you will miss the diagnosis. So that's another issue that will be reiterated by this guideline. Know the signs and symptoms and consider the tumor in an early stage.
And that, I think, is so critical for people, because you mentioned this is rare, yet having that ability and that knowledge is going to change the field in terms of being able to recognize it.
Yes, that's right. So, but there are some other issues here. The recent years there are new exciting developments, especially in the genetic and imaging field. And well, we thought that if we have the best available evidence, this could help the physicians to select the most effective test to find the tumor by imaging, or to determine if the patient has an underlying germline mutation for development of the tumor. So that's another issue. It's still an area of some controversy, but and for the time being, I think this guideline can be of help to help the physician. Can be of help for the physicians to, let's say, which test would be the first, or should we do all tests in all patients, etc.
So let's continue. Issue applied in Ecuador. In Ecuador, this medicine is known as Paraganglioma, and it is used to treat symptomatic treatment for chronic stable angina in coronary artery disease, others who have intolerance or contraindication to use beta blockers, or in association with beta blockers in patients that are not controlled with an optimal dose of beta blockers. Treatment of NYHI plus 2 to 4 chronic heart failure with systolic dysfunction in association with standard treatment, or when beta blockers are contraindicated or not tolerated. Here's the last video.
Pheochromocytomas and paragangliomas are a very rare subtype of neuroendocrine tumors, with a striking difference to most of the others in that they unfortunately carry a very poor prognosis when they have a proper malignant phenotype. So 80% of these patients will be cured just by surgery, but there is 20 to 30% of them that would either have a recurrence after surgery or would present with metastatic disease. And unlike most other neuroendocrine tumors, pheos and paragangliomas do not really respond very well to conventional therapies, including chemotherapy. There has never been a trial showing that these treatments will prolong survival of patients or improve their quality of life. So there is an acute need for novel therapies. In terms of our own study, we wanted to look at the interplay between hypoxia and the regulation of PD ligands, which are two molecular mechanisms on which malignancies tend to rely on to progress further, knowing that actually PD-L1 and PD-L2 expression is an actionable driver of the immune response for which new therapies are available. So what we found is that, quite strikingly, 15 to 20% of the patients who present with pheochromocytomas and paragangliomas do display an upregulation of either PD-L1 or PD-L2, to suggest that these two targets are somehow involved in the immune tolerogenic environment in these tumors.
So let's continue. In conclusion, regulated impulse generation with Ivabradine is one possible approach in managing sinus tachycardia in patients with confounding elevated catecholamine levels and beta adrenoreceptor desensitization, and therefore diminish response to beta adrenoreceptors blockers. Thank you for everything, and follow my social media accounts